Hi, how y'all doing? It's been a while, huh? I know, I got a little busy with work. So, I want us to use this video to continue our high risk pregnancy series. We're already talking about hypertension so far. Now, if you are on my Instagram page, you must have seen the little tidbits I've been leaving all through the week as far as hypertension. I will try and summarize those here for those of you who are not on my Instagram page yet. Please hurry over there. But also so you're not entirely lost in this conversation. Okay. So first of all, what is hypertension? Or if you've ever been told you have hypertension, it's basically when your blood pressure is usually above 140/90s. I know we in OB, we're still using 140/90s. I know those in family medicine by the American Cardiac and Heart Association have a different definition, but in obstetrics and gynecology, we haven't quite changed ours yet, though we are not disputing those recommendations that now puts it in types or stages. So however way they've diagnosed you with hypertension, it still stays, okay? But what we need to do is see how we can manage your pregnancy more closely so you don't have any further complications from that, okay? So that's why I use that definition. Now, the other thing about hypertension is, I'm sure even when you were diagnosed, or most of you would say, but I feel fine. Usually you will. That's what we call hypertension, the silent killer, because it doesn't necessarily present symptoms until it gets really, really worse, and people either have a heart attack or have a stroke and also even die from it. In addition, in pregnancy, it is one of the highest causes of maternal deaths when you die. I can't probably say the word today. I don't know why. But you get my point. Okay, so that's why it's very important, because if we're trying, which we are all trying to do, to reduce the number of women dying in and of pregnancy, we need to address hypertension, and that's why I'm making this video. So how would you know that you have high blood pressure in pregnancy? Before I get to that point, let me quickly say that most times when you're not pregnant and they're treating you for hypertension, I hope you're still taking your medication. Please don't ever stop taking any medication until you have discussed with your doctor or any provider who gave you that medication, okay? Now, sometimes when they are managing your high blood pressure, they will give you a medication that will either seem to protect your kidneys and or protect your heart. Those are fine as much as they are well intended, but it may not necessarily be safe for you to use those medications in pregnancy. That's why you need to tell us your OB/GYN so we can review the medications with you and also discuss with either the cardiologist or the nephrologist to see how we can come up with a better medication that will serve both you and the baby without sacrificing either of you. Okay? So, why is hypertension important in pregnancy? Because it can increase the risk to the pregnancy. It could make for you to have an increased risk of having diabetes in pregnancy. It could increase the risk of you having preeclampsia, which is basically increasing blood pressures in pregnancy or worsening hypertension in pregnancy. Okay? It can make for your baby not to grow well, so baby is much smaller. It can make for your placenta to separate from the uterus. When that happens, the baby could die because now you're suddenly bleeding inside. Okay, it could make for us to make recommendation for you to have an early delivery. In addition, if your blood pressure is not well controlled, you as a mother, the pregnant woman, could have a stroke. You could bleed into your brain and you could die. And we don't want that. And that's my strong, firm belief that no woman should really ever have to die in and of pregnancy. So that's why I'm making this again. I know I've said that earlier. So what are the signs that you should look out for in pregnancy? One common one is if you're having persistent headaches that is not going away with medication, such as maybe if you're taking Tylenol. Let me use acetaminophen because the name might differ in any country depending on where you're watching me from. So if you have persistent headaches that is not going away with acetaminophen, that could be a sign, especially if the headache is accompanied by blurry of vision or you start to see dark spots in your vision. That's a concern. Okay, another sign to watch out for is when you have pain in your right upper belly, especially when you touch it. It could be a sign that your liver might be getting involved. So you see, it can really get serious, and that's why I'm saying, Vera, I can't say it enough. You need to not stop your medication, and you need to be calling someone or going to the hospital. And by calling someone, I don't necessarily mean phone a friend. I mean phone your OBGYN, or just come to the hospital. We'll meet you there. Okay? Now, so they've told you have high blood pressure and now you're pregnant. What can we do? There are some medications we might need to start you on to reduce your risk, such as an aspirin. But please, any medication that I'm saying here, do not go and start and buy it off the counter and start to take it before you speak to a doctor. That's not the intention. Okay, but however, there are medications we can use to reduce your risk. Okay, would need to get some blood work done so we can know exactly where you're starting from as far as your kidney function, and we can manage you following through the pregnancy to see when things start to get worse and how and when we can intervene. You'd also need to have frequent ultrasounds to see how the baby is growing, how much fluid you have around your baby, because these could be signs that we need to be thinking about delivering the baby earlier than needed, or just having you stay in the hospital where we can monitor you more closely. And at some point, we'll also need to make plans, because sometimes we might need to either put you on medication to control your blood pressure or just make for delivery. Because sometimes staying pregnant is higher risk, because now you're having a higher risk of having a seizure and or a stroke. Stroke basically bleeding into your brain, or there is no blood going into your brain. Okay? Again, always at every point, you can DM me, put your questions in the comment sections, and I would answer the questions or make a follow-up video just to answer those questions. I intend not to make these videos excessively long so I don't lose anybody because of its length, but I'm always here. Please, please, always DM me with questions or put in the comment section, and I promise I would answer every single one of it. Have a good day. Again, it's your Dr. Ketchy. Bye.